Risk factors associated with bleeding after prophylactic endoscopic variceal ligation in cirrhosis. Introduction. Bleeding from esophageal or gastric varices is a life-threatening complication resulting from portal hypertension and liver cirrhosis. Esophageal varices are present in 40% to 60% of cirrhosis patients, and annual incidence of first variceal bleed is estimated to be 4%. Endoscopic variceal band ligation, EVL, with or without non-selective beta blocker therapy is a central element of primary and secondary bleeding prophylaxis in patients with medium and large esophageal varices and has been shown to be effective in reducing bleeding complications. Yet an important potential complication of EVL is procedure-related bleeding, which has been described in 2% to 6% of cirrhosis patients undergoing EVL. However, risk factors for bleeding complications in patients receiving EVL are not well established. Changes in routine coagulation test results are a frequent finding in patients with liver cirrhosis. The typical laboratory pattern of hepatic coagulopathy often includes reduced platelet counts and function, elevated international normalized ratio, INR, and decreased fibrinogen levels. Whether these changes directly translate into an increased bleeding risk remains a matter of debate. At least under stable conditions, a rebalanced hemostasis has been suggested in patients with chronic liver disease, mainly attributable to a reduction of both pro- and anticoagulatory factors. The primary aim of this study was to determine factors associated with upper gastrointestinal bleeding, UGIB, in cirrhosis patients within 30 days after prophylactic EVL. The secondary aim was to assess the impact of substitution of blood and coagulation products on bleeding risk in these patients. Background. Prophylactic endoscopic variceal band ligation is frequently performed in patients with liver cirrhosis. The aim of this study was to identify factors associated with early upper gastrointestinal bleeding in cirrhosis patients after prophylactic EVL. Methods. 787 non-emergency EVLs performed in 444 patients in 2 German university medical centers were analyzed retrospectively. Results. Within 30 days after EVL, 38 UGIBs were observed, almost 5% of all procedures. Bilirubin levels and presence of varices, grades 3 and 4, according to Paquette, were independently associated with UGIB following EVL. International Normalized Ratio, INR, was associated with bleeding events in the univariate analysis but did not reach statistical significance after adjustment for bilirubin and presence of varices, grades 3 and 4. There was no statistically significant association between platelet count or fibrinogen levels and UGIB. Substitution of coagulation products did not affect incidence of bleeding after EVL, which also applied to patients with coagulopathy. No association between proton pump inhibitor therapy and post-EVL UGIB was observed. Conclusions. EVL is a safe procedure and immediate bleeding complications are rare. Serum bilirubin levels and size of varices, rather than coagulation indices, are associated with UGIB after EVL. Our data do not support the preventive substitution of blood or coagulation products.